Media land or out there on the news about death panels. And we remember those from a few decades ago. Well, some people think they're back, but this time it's not human beings, doctors, bureaucrats, corporate profiteers on the death panel, but it's artificial intelligence robots supposedly going to be denying your Medicare claim. So we see a lot of social media out there. So let's just cut through it. And there's some good, there's some bad, there's some definitely we need to watch out for this. Some cautions that we need to take because one of those slippery slopes. Okay, it might be okay, neutral. It's waste, fraud, and abuse. And as we know, the current way for the government to do anything they want is immediately say fraud, waste, and abuse. As soon as they say fraud, waste, and abuse, they're allowed, I guess we allow them to do whatever they want. So this is one of those things that they're saying fraud, waste, and abuse. Is there fraud, waste, and abuse in Medicare? Of course. There's Medicaid, Social Security, credit cards, home loans, mortgage, banking, Wall Street, fraud, waste, and abuse. So, in terms of the government, they want to throw the baby out with the bathwater and just say, okay, hey, there's fraud, waste, and abuse. Let's just go ahead and shut it all down and give it over to Wall Street. Okay, so let's talk about that today. So there's a couple of models that are going to be started. Artificial intelligence, prior authorizations, and your Medicare. So, as I mentioned, there's some yellow alert cautions that we need to take before it gets into the red danger zone. So these are limited pilots. So there's two of them. One is called the WISER model, and it's called Wasteful and Inappropriate Service Reduction. That's the new acronym for this thing. So it starts January 1st, 2026, and runs for 6 years. So let's first talk about who this applies to. If you are in a Medicare Advantage plan, then you already have prior authorization, right? If you have a Medicare Advantage plan, a Part D plan, then prior authorization already exists. Your doctor says you need X, Y, and Z, and then your doctor has to go through the whole nightmare of getting approval from that particular company, okay? So you already have prior authorization. They did have particular companies using artificial intelligence, AI, to deny those claims, and they got in a lot of trouble for doing that. So it sounds as though the government is saying, okay, you can go ahead and use AI now with some stipulations, and we'll talk about those. If you have a Medicare supplement plan, a Plan G, a Plan N, a Plan F, or whatever the case may be, then you have original Medicare, and this applies to you. If you have a Medicare Advantage, you already have prior authorization. But remember, we are in the new season, which starts October 15th, and this month in September, about 1 million people are going to receive a letter from their Medicare Advantage plan that says you are canceled. There's a lot of people are going to get these letters, and their Medicare Advantage plan is going to be canceled effective December 31st, and they're going to be without. They have to find something else. Predominantly, about 600,000, 700,000, 800,000 of these are going to be those people that have PPO plans. So when you get a Medicare Advantage, you get an HMO or a PPO. So if you have a PPO plan, you make sure you check your mail because if you're canceled and you don't know about it, then January 1st, you're just going to have original Medicare. And original Medicare is awesome and everything, but there's a lot of gaps there. The big one being Part B, that you have to cover 20% of anything. So, well, not everything, but if your doctor gives you a $100,000 Band-Aid, you have to pay $20,000 of it, 20%. Medicare pays the other 80%. So those people that have Medicare Advantage, a PPO, and that are canceled can return to original Medicare. So this is a new option that you have. If your plan was canceled, a lot of people out there, please cancel me, because then they can return to original Medicare and then get a Medicare supplement plan, an N or a G, usually a G, but it depends on whether you're healthy. But you don't have to go through a health underwriting if you want a G or an F if you're if you're eligible for an F. Most people will get a G. So then you don't have prior authorizations and you don't have networks, is what we used to say up until January 1st, 2026. And guess what? You are now going to have a limited amount of prior authorizations. So if you have Medicare supplement, original Medicare to Medicare supplement, all this we're talking about today applies to you. If you have a Medicare Advantage and you are going to be returning to original Medicare, then this applies to you and you really need to watch it. And I think it applies to everybody, because if original Medicare starts going down the road of prior authorization, then everything is going to change. So it's going to be something we need to watch out, something we all need to watch out for, particularly if the government allows AI to get involved in all of this. Okay, so that's who this applies to. And the yellow danger is, okay, this is a limited pilot. One only runs for 5 years. The other one runs about 6 years. I didn't put it down there, 5 years, but anyway. Let me change that right now, add that in there for future reference. This one goes for 5 years. This one goes for 6 years. Okay, but those can be extended. The WISER model, Arizona, New Jersey, Ohio, Oklahoma, Texas, and Washington. And this other one, ASC, which is ambulatory surgical centers, California, Florida, Texas, Arizona, Ohio, Tennessee, Pennsylvania, Maryland, Georgia, and New York. Okay, so let's get to the WISER one. Limited services that are going to be under prior authorization: spinal fusions, pain injection, nerve stimulators, incontinence, ED devices. So these are the ones that CMS said, hey, there's a lot of fraud going on here. And we all like, when they address fraud. Okay, perfect, awesome. But original Medicare has always, there's two different systems. Original Medicare predominantly doesn't get in between you and your doctor. So if your doctor says you need X, Y, and Z, then that's it. If it's medically necessary, you get it. And then Medicare approves it, pays the doctor. But then if it turns out, that doctor, someone, drops the dime on that doctor, someone called Medicare and the OIG, the Office of Inspector General, and said, hey, this guy is shady. They investigate that person, and then they maybe put that person in jail or have to pay restitution, lose their Medicare license, so they can't, the ability to bill Medicare. So that's how Medicare does it. They do it after the fact. They don't get in between you and your doctor. Medicare Advantage, they get in between you and your doctor on the front end. So your doctor has to submit this and submit that, submit this other thing, and get prior authorization to do whatever. But original Medicare, there's an exception, a couple of exceptions. Original Medicare does have a prior authorization. Remember a few years ago, those power scooters, the rascal scooters that people used to drive around, still do. Remember when there was companies out there that found a loophole and they were giving those things to everybody? Yeah, Medicare we lost a lot of money in that one. So original Medicare said, hey, no, you have to get a prior authorization to get one of those scooters. So there is a prior authorization. There's like one or two other very, very, very small things. It's usually, like those devices like that, power wheelchair, power rascal type of things. But other than that, original Medicare really doesn't have a prior authorization until now. So now they're going to have prior authorizations, and what it's going to be is, under this WISER model, is that they're going to, here's what we need to watch out for. Because this fraud, waste, and abuse, DOJ did a terrible job finding fraud, waste, and abuse. They didn't find any fraud, waste, and abuse. They made a bunch of crazy allegations, but they really didn't find anything. Who finds fraud, waste, and abuse every day? We do. The people that work at Social Security, people that work at Medicare, people that go to this particular doctor's office and see that the person is doing something shady. We call the 800 number, Medicare, and we inform them, hey, this guy is doing something shady. So we are the ones that find fraud, waste, and abuse. So these companies are going to be hired. So they're the CMS, Center for Medicare and Medicaid Services, have put out, a notification, say, hey, companies out there, if you're in these states, or, if you work in these states, and you want to make some money, go ahead and apply. And what you will do is, in these particular states, these particular services, these doctors and clinics and hospitals will send you those requests for prior authorization, and you can use AI to sort all of those things and look for something that doesn't look correct, that looks fraudulent or questionable. And then you have to have a human being. The AI itself cannot deny it. A human being, an actual doctor that's a specialist in that, hopefully, is supposed to look at it in the final analysis and look at it and say to approve it or deny it, okay? One of the problems with that is the companies get paid for how much they save, okay? We like that. They get paid for how much they save, AKA they get paid when they deny something. So if normally this person would have gotten paid for whatever service, this doctor or clinic would have gotten paid for whatever service, and that new AI company denies it, they get a percentage of the savings. So it's beneficial for them to deny as many as possible. Hopefully there will be oversight. And there are, you know, if it's emergencies or hospital admissions or something like that, then, you know, there is a little exceptions there. So this is definitely something we need to watch out for, is these companies coming in there. Okay. Again, AI, you can use AI, but you have to have an actual doctor look at it before you deny it. And, you know, just don't start denying all these. So there's a few places that they can, you know, scam the system. One is, you know, they just deny people left and right so they can make more money. Or, you know, these companies, maybe they have a bunch of clinics, and so they get their, you know, their clinics and doctors out there and say, hey, submit, you know, we don't care, just submit it, submit this request, and we'll deny it, and then we'll make money. So yeah, we definitely have to watch out for these, because as we know, I know some people out there are not going to like to hear this, but the current administration, if you commit Medicare or Social Security fraud, you'll probably be pardoned if you're well connected. Look at the case for Lawrence Duran, Florida, submitted close to 1 million fraudulent Medicare claims, pardoned by the current president. Another guy in Florida, convicted, about to go to jail, stole millions of dollars of Social Security money from his employees, from us. We have to pay it back. Pardoned after his mother allegedly gave $1 million during a Mar-a-Lago thing. So these companies might be doing some bad stuff for a while, making a lot of money, and then the CEO get caught and convicted and about to go to jail and just might get pardoned. And, you know, so much for the whole, you know, it's all about fraud, waste, and abuse, right? So unfortunately, some people are not happy to hear that, but you can look it up. So, and there's another model called the ASC Prior Authorization Pilot, which begins December 15th, runs for 5 years. California, Florida, Texas, Arizona, Ohio, Tennessee, Pennsylvania, Maryland, Georgia, and New York. And those are ambulatory surgical centers, you know, centers that you know, walk in, get a surgery for the day and walk out. You know, it's not like an overnight type of thing. Cosmetic, borderline procedures. So Botox and stuff like that, you know, for instance, that's one of the things that's covered. You know, people that have migraines and stuff get Botox and it works. But Botox, cosmetic purposes, right? Rhinoplasty, which I wish I could get covered, but anyway, that's a nose job. But anyway, some people, it is medically necessary after a terrible accident or something like that. They need it, but not for cosmetic purposes. So that's what that's supposed to focus on. So there's particular procedures out there that are medically necessary, but sometimes they're just cosmetic. And so there's prior authorization for that one. This one is a traditional, like a prior authorization. These are not companies that are going to make necessarily profits by denying, and they're not allowed to use artificial intelligence in these particular cases. So I just wanted to throw this out to you and give you that information. You can take a screenshot of this, and that way you've got it for the future. But again, we need to watch out. These companies haven't been chosen yet. I've checked earlier today, and the companies under the Wiser model haven't been chosen yet. Those companies that are going to make profits by denying people. So whatever companies are chosen, we definitely need to watch and make sure, they do everything correctly. And the slippery slope, the red, the danger part of this is that they're introducing prior authorizations, with artificial intelligence denial capabilities to original Medicare. And yes, a limited group of stuff, but what happens when those companies say, hey, we're not making enough money with just these services. We need to expand services, for other things, knee replacements, hip replacements. Let's go ahead because we need to start making more money. And they go contact their politicians, make some type of donation to the politicians, re-election campaign. And then all of a sudden, everything becomes a prior authorization. So that's not where we're at right now. There's a lot of social media people out there that saying that's where it's immediately AI. So, but we're not there now. But it's important that we keep an eye on this. And our team here, our community here is definitely going to keep an eye on all of this. So, and remember, we are the ones that Elon Musk, complete failure in finding fraud, waste, and abuse. Doge, pretty much up to now, complete failure in finding fraud, waste, and abuse. All y'all find it every single day. So if you find it, look at your bills. I'm going to have we're going to have one of the people from chapter next week, or actually this week, haven't this week or next week, but soon, on the member success team. And they're the people that, for chapter, people that are chapter members that, got their plan through chapter. If you ever have an issue, need to find a new doctor, got an issue on your billing, why wasn't this covered, need help with the prior authorizations, these are the people that help you out, the member success team. So we're going to have a member of the member success team come in, and I'm going to ask her about, how to check your bill as well. Because a lot of these, clinics and doctors and stuff, that's one of the things they do. They upcode. You go in there for a Band-Aid and they say, hey, okay, a Band-Aid is $10. And then they upcode it to a tourniquet or something. And now they get $1,000. So we want to make sure we're able to read that and then, drop the dime on those people and save us our taxpayer money. So, all right, let's get into some your questions here. I have an Advantage plan. What would be the best plan to go with? The best plan is for my particular situation, because it's all depends on your particular situation. I would like a Medicare supplement plan G or plan N. But if you're unable to get that because you wouldn't be able to pass health underwriting or it's just not in your budget, then a Medicare Advantage. It really depends. Chapter goes by the 3 Ps about your prescriptions, your physicians, your providers, and then the price, and then all the other bells and whistles. So, and remember, these Medicare Advantage plans are only good for 12 months. They expire. All the Medicare, if you have a Medicare Advantage plan, it expires December 31st. It might automatically renew. Your current one will automatically renew, but it will renew with different details. And that's the issue. You have to look at those new details. And this month, you will get what's called the annual notice of change. The annual notice of change is what these Medicare Advantage and Part D plans have to send out once a year in September and says, hey, next year, your plan is, instead of $100 a night for hospital, we're going to start charging $200 or $300. How much for this prescription? We're going to start charging more for this prescription. We're going to change the tier. We're going to change this to, non-generic. And we're going to take this out of our formulary. So they can do pretty much anything they want to change it. And they don't want you to check. They do not want you to check. So for Paul, it starts October 15th. You can reach out to chapter starting October 15th and start getting an idea of what we're looking at, what you're looking at in your particular plan. And remember, you have till December 7th. So I'm adding another P to chapters, 3 Ps. The fourth one is patience. don't try to, get in on chapter October 15th, because everybody's going to try to do that. You have till December 7th, and no changes will take effect until January 1st. But this one is going to be a crazy, crazy, crazy season, because of all the changes, the million people that are going to be losing their plans. So yeah, we just have to have a bit of patience. But they'll definitely take care of you. I'll make sure of it. Megan, I had a VNS implant for several years for my epilepsy. Will it still be covered? Yeah, there's the nerve. Are we talking about a nerve stimulator there? If it's been covered, then yeah, I don't see any change with that at all. Again, I'm a doctor, but I'm not that kind of a doctor. So, it depends on if you have original Medicare, you have a Medicare Advantage plan. So make sure, you reach out to your doctor and make sure everything is, cool and copacetic. And yeah, Social Security is our money. We work for it. It belongs to the American people. We need to pray or pay. They need to pay. We need to pray that they pay. Yes, I agree. 100%. That is our money. And it wasn't stolen. The money is in, treasury bonds. It's just that, just like any savings, it's not going to last forever. Linda, Abe is on SSDI since he turned 18 years old for brain injury when he was born, progressively getting better, which is a miracle. Awesome. Please clarify if he can change his address in the Social Security office. Yeah, absolutely. You can. If Abe is on SSDI, then are you the representative payee? So you're the one ultimately responsible to make sure, that the benefits go for, his welfare. Then you can change it yourself. Go online, set up an SSA.gov account, My Social Security, and you should be able to go in there and change his address through that. But if not, for whatever reason, yeah, call the 800 number. And then you're the representative payee, so you're allowed to do whatever you need to do. If you're not the representative payee, you should definitely be designated the representative payee. Social Security does not recognize power of attorney. Social Security doesn't. I've had a lawyer say, don't say that. Yes, because the lawyer says, but power of attorney can be used for other things. Yes, I understand that. But for Social Security does not recognize power of attorney. Why? Because why people use that is they say, hey, I want this person to take care of my benefits for me and, my check and all that kind of stuff and talk to me on my behalf. Well, if you have a power of attorney, that means you're of sound-minded body and you can give that authority to someone. And if you're of sound-minded body and you can give authority to someone for that, then you can take care of your own benefits. So, but if you need a representative payee because of that, that's where the representative payee thing comes in. So it's easy. It's just a super easy application. Takes about 5 or 10 minutes, and you will be the representative payee. So, guys, please look at your receipt that is stapled to your script and look at the retail price and then what you're being charged. My retail was $53.09. They were going to charge me $98 for tier 2. Yes. Yes. We always like to give people the benefit of the doubt, and it might just been a typo or incorrectly coded, and that's where a lot of they talk about, like, particularly for Medicaid fraud, which is the big one in the news right now. Medicaid, how much fraud? Most of the fraud in Medicaid is just paperwork type stuff. Yeah, there are people ripping off Medicaid. Of course, there are. People rip off everything and ruins it for the rest of us. I know. But a lot of it is just incorrect paperwork, untimely paperwork, and, just mistakes and stuff. So yes, check your paperwork. And that's what we'll ask. So keep smiling, make sure you come on back. And maybe we might have to have an extended class, because we're going to appoint you deputies, OIG deputies. Maybe we'll get an OIG person, the Office of the Inspector General, in one day and appoint you all as deputies to go out there into your communities and, get this fraud, waste, and abuse and get it taken care of. So I received an unsolicited letter saying that I always avoid saying company names, in my area will no longer offer the Medicare, Medicaid coordinated plan. They want me to sign up with them. Okay. So yeah, I'm sure they do. But whether that's the best plan for you, then yeah. So it looks like they stopped the DSNPs, the dual special needs plan. So they're dropping you. It really depends if you're going to continue having Medicaid. It sounds like you're probably still going to have Medicare and Medicaid, so you're still eligible for a dual plan, the Medicare, Medicaid coordinator plan. You just need to find another company. But if you're going to be losing Medicaid or it's going to be downgraded, then you need to find a completely different Medicare Advantage plan, not one of the dual plans. So you can reach out to, if you've got an agent broker that you know and trust, reach out to them. If not, you can reach out to Chapter and they can help you find another Medicare Medicaid coordinated plan, which is just the DSNP, the dual special needs plan. So let's see. One of my doctors was born and raised in Utah. And when I told him I needed a script for COVID, he called RFK Jr. a kook. Said he's always been a Democrat. Yeah, I think in Utah and some other places, you have to get a prescription for that now. So the CDC is, it's about to crap my pants when I told me that. Says that wasn't me. Someone else said that. Our HMO paid $1 million in 2002 when the twins were in the NICU for 9 months, and we paid $250. Awesome. That's $1.8 million today. We still have the $250 payment. All HMO not bad. All ours certainly isn't. Exactly, 100%. Yeah, a lot of people have great help. Yeah, Bella talks about that she loves her plan. So yeah, absolutely. But the important thing is, again, you love your plan this month or this year, but it goes away December 31st. And when Ari came here a few days ago from Chapter, he had mentioned that, these Medicare Advantage plans, they're in it for a profit. I hate to break the news to you. So they're either, he says they're either in two stages. They're in their expansion stage or their margin stage. So which means basically that, the board of directors and the CEO and the bigwigs in these particular companies say, okay, what do we want to focus on this year? We want to focus on expansion. So we want to make the benefits really good and try to get as many people to join our plan as possible. Or let's give discounts and this and rides and grocery cards and bells and whistles and free ice cream and unicorns so we get more people to sign up. Now they're in their margin phase. That is, they want to get as much profit margin as possible. So that's one of the reasons they're cutting close to 1 million or probably over 1 million people from those PPO plans because, they expanded and got 1 million people. And now they're like, yeah, we're not making enough money on that. We really need to focus on the bottom line, how much profit we make from each. So glad you had a perfect, but remember, every year is different. So if that would have happened this year in 2025, how would it have gone next year? So just cautionary tale. Just keep up on it, and sounds like you're doing. But yeah, if I always say, I always recommend Medicare supplements if it's in your budget and everything, if you can get it. But if you had a crystal ball and you knew you're going to live the next 60, 70 years and not really get sick or injured, I would 100% get a Medicare Advantage plan. 0 premiums, all the bells and whistles. Heck yeah. But I wish I had that crystal ball. If I did, I would have started using Rogaine about 30 years earlier. Anyway, I live in Michigan and trigger point shots can have limited to 3 shots a year now, and it is the only thing that I can have that helps. So this model is not accurate. It's happening elsewhere. Yeah, well, you have a Medicare Advantage plan, and they can limit stuff like that. But remember, on any of this, let me pull up my website here. So mygovexpert.com, you click on the appeals here. Click on that little appeals button and it tells you about all your appeals. If you think you need another shot, if you think you need this, if you think you need that, the doctor says you need this, that, and the other, and whoever it is, the Medicare Advantage plan, your Part D plan, original Medicare says no, fight it. Please, please fight it. And on my website, you go to, again, go at the top there, click on more and click on appeals. And it gives you that you can go to medicare.gov and it'll give you kind of the same information. I would argue mine is actually in English. Easy to understand English. So original Medicare, you can fight it, different level of appeals there, and always fight it. And if you have a Medicare Advantage plan, if the Medicare Advantage plan is limiting those shots and you disagree with it, fight it as well. So on those, you have to go through a Medicare Advantage plan, and each one has a little bit different appeal process. But please, prior authorization, denials, medication, if you're getting medication and you can't afford it because it's, tier 2 or tier 3 or whatever the case may be, fight it and say, hey, can you lower the tier on this because of my particular situation? I know this prescription isn't in the formulary, but I know there's so-called equivalent ones that you offer, prescription drug company. But that, the one you offer doesn't work. The only one that does work is this one. So you can ask for a formulary exception as well. So please, that's the issue right there. Power, knowledge is power, but it's not power unless you actually use it. So fight it, fight it, fight it, fight it, fight it. So, let's see. If a widow started taking her Social Security benefit at 65, 14 months ago and wants to switch to taking her deceased husband's benefit at full retirement age, can she do that? Does she only have 12 months from her starting? Okay, so started taking benefits on her own record at 65. Yeah, if you're entitled to surviving spouse benefits, yes, you can switch over, absolutely, to whatever the higher benefit is. So some people do that. When you have the option to file for surviving spouse, also called widow's benefits, widower benefits. Social Security calls it surviving spouse. If you have the option to take surviving spouse benefits or retirement benefits on your own record, you always check that out and see which one is best to take first, because you don't have to take both. You can take surviving spouse first or retirement on your own first. So it sounds like you started taking benefits on your own record, and then you want to switch to surviving spouse benefits. And remember, surviving spouse benefits won't increase after your full retirement age. So if your benefits surviving spouse, once you're your full retirement age, they're 100% of the benefit amount. Benefits on your own record, your own work record, those will continue to increase until you turn 70 years old. So different. So yeah, I would call up Social Security and say, hey, how much would I make if I switch to surviving spouse benefits this month? And then say, okay, change the MOE, the month of entitlement. Tell me how much my surviving spouse benefits if I start this time next year. And then you can make the decision of when you want to start it. But don't delay past your full retirement age, because it won't increase. Bella, I've been looking into healthcare in Italy. You're correct. It's the best. It said Northern Italy is the best. Yeah, a lot of countries out there do it a lot better. Yeah, but yeah, and then, just like Canada does things better, but they're short on other things that, Japan does things really, really good, but some of the things not so much. So yeah, we have to take the best from each country and say, okay, this works. That's how, yeah. That's how Medicare, that's how Social Security was started in the first place. So it could be cheaper, easier, safer to pay for your own prescriptions. My Medicare Advantage plan is the past did this with prescriptions potentially putting my life at risk. I use Scripto. They do not take insurance. Yes, Ari from Chapter talked about this, and yeah, some people do it. They get it from Mark Cuban's direct prescription or Scripto or, whatever. And that's fine. Yeah, if that's best for you. But remember, whatever you pay outside of your Medicare Advantage or your Part D plan, whatever you pay out of your pocket does not count to your deductible for whatever coinsurance you have under, let's say, your Medicare Advantage plan. So take that into consideration. So if you have other drugs that you're also getting from your Medicare Advantage plan, then, you have to run the numbers to make sure it's actually best for you. But if that's all you're getting, then yeah, it's usually, if you only get one or two and you get them cheaper outside, then it's usually okay. Let's see, is 82 and she has been dementia after seeing your program, told her to apply for surviving spouse benefits. We can't find divorce documents and tried Vital, but they do not, Los Angeles. Yeah, the, marriage certificate is usually, marriage and divorce decrees are sometimes kind of hard to find, particularly if she's 82 years old and probably got married a long, long time ago. So if you've tried, so Social Security can use a preponderance of the evidence. So if you have the marriage certificate that you prove that she got married, and you're just needing to prove if it's a divorce type situation, you need to prove the 10 years. If it wasn't a divorce, if they were married when he passed, then they just had to be married 9 months. Okay. So, but this was a divorce type situation, so you have to prove the 10 years. But if you try to get the divorce decree and you're not able to get it, it's usually, from the county, then you take that letter to Social Security. You take that letter to Social Security and say, hey, we were divorced in LA, but they lost it, and here's the letter that shows that they lost it. And then Social Security, the employee, can work on a preponderance of the evidence, just to show that y'all, they were together for 10 years. So they can, if, any other documentation, life insurance policy, mortgage, anything like that, to show that, they were actually still married. And then so they can use a preponderance of the evidence for other information. So please, call Social Security, set up an appointment, file, and then tell them the situation. And they also have some contacts. So if you've tried and you send that letter, are you sure they didn't take off to Vegas and get divorced in Vegas or something like that? Which a lot of people in LA do. But the Social Security employee will have, they used to before they got all their people moved out of the agency, have little connections that they can do a little bit deeper search than normal people with less experience can do. So, but most important thing right now is to call Social Security immediately and set up an appointment, and then have them figure out, the documentation. So how often should an expat call Social Security to submit proof of life? Yearly, even if no change of anything from the previous form? Yeah, that's, they just added another option for that proof of life form for people that live overseas, that once you get the form, you don't have to send it back anymore. You can call the 800 number back in the United States, or technically the federal benefits unit in your particular region, which is always a nightmare to do. But anyway, there it is. But they didn't really say anything in the policy that I talked about a week ago on this, about, because some people get it every 6 months or year, every year and a half, every 2 years and stuff. And there's no rhyme or reason, it seems like, and when people get these letters. So if you normally get it every year about June or something, then, I would call about that time and just be preemptive and maybe get it done. So just in case something's lost in the mail. I sent 2 threads to a Social Security office and we discussed, okay, I'm not sure. Everyone who receives Social Security of any kind should probably be writing to all the reps telling them to simplify all of it and universal health care. Yes. So I can go back into retirement, which I won't do. But anyway, I got to get my papers. Hope they're here. Okay, let's see. Do you know what happens to a person that in the Washington State COPES program at FRA? Can they choose their own plans? Thanks. The Washington State COPES program. Not sure what the Washington State COPES program is. Is that I guess that's a healthcare plan. Can they choose their own plans? Well, you have, if you're at your 65, you have to get Medicare. Yeah, I'm not sure what the COPES one is. Is this a healthcare plan or is this a retirement plan? Not sure. I'll check that out. It's mostly hospitals, nursing homes, and facilities that overcharge. Yeah, usually, or there are shady doctors out there, but yeah, yes, hospitals, nursing home facilities, yes, they are seriously profit driven, and they can kind of take the hits. They can, tell their accounting department to upcode and stuff like that, and then the CEO gets kind of covered and got enough money to get pardoned. Yeah, but individual doctors, except for the really, really shady one, 99% of the, regular doctors out there to take Medicare, they don't want to lose their ability to accept people with Medicare. So yeah, they're usually legit. Yes, they're, as compared to others. Yes, you're 100% right. Contact the Capitol switchboard and speak to lawmakers on both sides. Yes, please. So saying Social Security is our money is only partly true. SSI is welfare, yes. But Social Security is our money. SSI is also our money, but not in the trust fund. The same department running SSA and SSDI may seem fine functionally, but culturally it causes animosity, even anger. SSI is not SSDI, is not my retirement. Yes, SSI is a completely separate program that Social Security administers, celebrated its 50th year last year in 2024. SSI started in 1974, supplemental security income, low resources, welfare-based program based on disability, or being 65 and older. So yes, and that money comes out of general taxes. So Mount Bluebird, I stopped the 185 a month deduction from Social Security benefits that they are ripped off retirees. Why? Because why pay so much extra and then say, oh, claim 4,000 deductible anyway. Well, yeah, if you want a Medicare Advantage plan or a Medicare Supplement plan or a Part D plan, you have to have Part A and Part B. So if you don't want any of that, then yeah, that's your decision. I just got approved for SSDI from Survivor Benefits. I'm 64. Do I have to wait on Medicare? Currently on Affordable Care Act, paying $186 a month. Yeah, there is no such thing as SSDI from Survivor Benefits at 64. There is what's called Disabled Widows Benefits, where you can get disability based on a deceased spouse's record. That's called the Disabled Widows Benefits, but that is between 50 and 59. But if you're 64, then yeah, unless you applied 5 years ago and you were just approved, which hopefully that's not the case. But maybe you are receiving SSDI on your own record and surviving spouse benefits on your deceased spouse's record. That is a possibility that you can receive both. So in terms of SSDI, if you have to have SSDI for 2 years, 24 months, and then your Medicare will start. But if you just got approved, if you just got the letter that says you've been approved today and it says we're going to give you 2 years of back pay, that means you've been on disability for 2 years, and then your Medicare will start essentially this month. But if not, then probably the soonest you'll get Medicare is 65. So, so did you get a big check back pay for the last couple of years because they approved you a couple of years back? If so, then your Medicare might be starting immediately. You can reach out to Chapter or call Social Security. Chapter has access to the Medicare thing where they can see when your Medicare starts. But if not, then a few months before you turn 65, That's might be the soonest you get Medicare started. They said they'll take it out of my money. Said no. You not told I'm leaving university. I'm probably going to head up there. Okay, not sure what this is. Love Dr. Weir's sense of humor. Oh, thank you. I appreciate it. I have kind of a twisted sense of humor, and yeah, so sarcasm, and people sometimes don't get my sarcasm. So anyway, there it is. What exactly does Part B pay of hospital expenses? So I went in and they found blockage in the heart. Wow. Do you have to pay the 20% to remove blockage with regular Medicare? Okay, so hospital Part A covers the hospital. And this is, it's confusing. So Part A covers the hospital. So the hospital charges, you know, the room and board and stuff like that, that's covered by Part A. But when a doctor does the surgery, when an anesthesiologist puts you under, that's not, even though they did it in a hospital, that's your doctor. And that is covered by Part B. And so if it's a $100,000 operation, then that's Part B. Part B of Medicare will cover 80% of it, $80,000, but you have to cough up $20,000. So if you have a Medicare supplement plan, then your Medicare supplement plan pays for the other 20%. Easy. A Medicare Advantage plan, then the Medicare Advantage plan pays for, you know, whatever minus co-insurance deductibles, whatever your Medicare Advantage plan plays. So you've got, you know, Medicare Part A covers the hospitals. Part B covers the doctor, outpatient type stuff. Part D, the prescription drug plan, covers prescriptions. And then there's Part C, which I hate it being called Part C. Part C is essentially Medicare Advantage plans. I wish they wouldn't have called it Part C, because then it sounds like it's part of original Medicare. It's not. When you get a Medicare Advantage plan, you're essentially giving up original Medicare, and now you have to get all your health care taken care of through a particular company. And if it's best for you, then it's best for you. Then if you like it, just keep an eye on it. Richard, add one question. How do you get around a circle as their fault? I can prove it. If I go to court, will stop my benefits. You made a big mistake. I never said no document. Okay, not sure what all that means. I only got one video question today. And if about someone that has a Charles Schwab account, and I guess Charles Schwab canceled this person's checking account, and they want to know how they can do this, and they tried to call Social Security and get it fixed, and yeah, Social Security's not going to fix it because they're sending the money. It's just that I guess Charles Schwab canceled your account. You just need to go find another bank. So super easy. Well, solution is easy. You know, go and set up another bank account might not be, but anyway. All right. So, but video questions on my website, mygovexpert.com there. If you go into the website and on the bottom left there, you can see question or comment. So you can click that little button and then it takes you to a little thing and you can record a 2-minute video. Make sure you have your once you record it, you can listen to it and make sure everything is good. I had a couple yesterday that there was no audio whatsoever, so I'm not sure what that person asked. So if you have a question, you have a comment, you have a personal story about being denied or approved, or some office did a really good job or a terrible job, please leave it there and I'll play it the next day. So traditional Medicare doesn't pay much. You need a supplement or some sort. They do pay, 80%. That's pretty good. Yeah. So, but unless you got a whole bunch of money, you definitely need to, find something else out there. Can I rent out a second home? I have a mortgage on it. I collect surviving spouse benefits. Yep. Doesn't affect your Social Security survivor benefits at all. No problem whatsoever. Let's see. Death panels have always been located in the insurance industry. Yeah, you got a point, don't you? Can I still get survivor spouse with Medicare Advantage if I cancel the 185? You can, the survivor spouse, you cannot have a Medicare Advantage plan if you do not have Medicare Part A and Part B. So you have to have Part A and Part B in order to get a Medicare Advantage plan, in order to get a Medicare supplement plan, all the rest of it. So I email my senators and congressmen and women, and when can I almost always ask to stop FICA limit? Yes, there you go. That's the one thing that is going to save Social Security, to make sure. I mean, Social Security is going to be around here for hundreds and hundreds of years as long as we don't privatize it. The problem is, if they don't do anything, your checks are going to be cut by 23% in a few years. And they don't seem to be wanting to do anything about it. She said, that's what I get for working my whole life. That's what you got. Okay. We got a, not sure what kind of conversation we have here. All right, Zelene, I got a letter from Medicare today saying my out-of-pocket prescription will increase in 2026. Yes. So you got your ANOC letter, the annual notice of change. So, yep, that's, again, these plans are only good. The Medicare Advantage and Part D plans are only good until December 31st. And then, January 1st, you're driving around in the new, Lamborghini or Corvette or whatever. And then if you don't check, then January 1st, you go out into your parking lot and you got a 1972 Pinto waiting there for you. They repossessed your Lamborghini and stuck, okay, for Pinto lovers, they stuck a Ford Mustang. Oh, the Ford Mustang. Oh, not the Mustang. Was it the Maverick? Yeah. My mother always bought a Maverick for some reason. They were kind of crappy car. Anyway, let's see here. So you have to check. You have to check. So, Dr. Weird, what do you charge for you to come out to talk to groups about Social Security and Medicare? Yeah, I don't really. Yeah. Yeah, I don't like traveling that much unless my wife makes me take a vacation and go someplace. And even then, I'm like, I really need to work on some videos. I have emailed REM Remote Area Medical about 2026 schedule. Provide free medical, dental, vision with volunteer healthcare providers. I've used them in the past. Oh, okay. Awesome. Carrie, we're going to need your help on this stuff. The new thing that we're working on today, I'm going to have a meeting with my computer programmers here today to see how our new platform is coming. But one of the things that we're going to be doing on that is helping people find resources, all these types of resources. One of the problems is people just can't find those resources because, it's difficult to find. So we're going to make it easier. So Carrie, we're going to need your help in the future on that. So if you notice a change in the pill shape or size you're taking, look at the MFR.2 of the meds change size shape. I thought just a different formula. I researched them both, recalled from the prior manufacturer. Oh, good. Yeah, and be careful when you check out your prescriptions and stuff like that. It's amazing. You got extended release sometimes, or even more expensive. So if you can do like a regular one versus extended release, you might save some money. If you take a regular pill versus capsule, a tablet versus capsule, little gel type things, those are sometimes cheaper. And so yeah, there's all kinds of different things you can save some money, and just keep an eye on it. So, let's see what other quantity. Let's see. My 2 years for SSDI just happened to hit the month I turned 65. Yeah. So that didn't help you at all, did it? So, for proof of divorce from many years ago, 1975 in Los Angeles, can't find records, and she has dementia. She only gets, okay. Yeah. So, you just need to provide proof from that agency that you sent off that says we don't have it. It was lost in a fire, or those, were, moldy and they were destroyed, or whatever the case may be. And then, yeah, so they can use other evidence, preponderance of evidence. So just get anything you can to prove the 10 years marriage. So yes. Have a disability from widow's benefits. When I turn 67, will I get any of his Social Security? Yeah, again, disability from widow's benefits. If you're receiving disabled widow's benefits, then it won't change. You're receiving, if you're receiving disabled widow's benefits, it's 71.5% of his benefit amount, and it'll always be 71.5%. So, why don't we have universal health care like many other countries? Yeah, because these companies are making tons of money doing this, and they don't want to give up the golden goose. So, I'm a United States Air Force retired. Thank you for your service. If I withdraw Social Security now at 62, does my retirement paycheck, VA disability payment, stocks, and mutual funds count as earned income towards my limit? Nope, they do not, because they are unearned income. You earned them, obviously, but earned income means you're actually working and earning income right now. So VA check, not earned income. You're not working for it right now. Disability payments, no. Stocks, mutual funds, nope. None of that will count as the annual earnings limit, the 23,400. None of that will count. And then your obviously your Social Security check that you receive. So basically, once you receive Social Security, and they ask you how much you're going to be making, you say zero. So you can go out there if you want, if you're able to get, part-time job and make $23,400 on top of that, and you're good. When it's time to sign up for Medicare, can I purchase a supplement plan at any time if I didn't initially purchase the supplement plan? I know to sign up for Part A and Part B once credible coverage ends. You can sign up for a Medicare supplement plan anytime, 365 days of the year. Depends on your state and depends whether you can pass health underwriting. If you have a Medicare Advantage plan, then the problem is you can't have both. So you have to get out of the Medicare Advantage plan. So if you have a Medicare Advantage plan, then you can switch to a Medicare supplement plan, but your Medicare Advantage plan has to end. So if you're able to switch to a Medicare supplement plan this season coming up next month, then you do it. It becomes effective January 1st because your Medicare Advantage plan cancels on December 31st. Yep. And if you have a Medicare supplement plan, none of this stuff, in terms of timing matters. If you have a Medicare supplement plan and you want to switch, let's say if you have a G plan and you want to see if you can switch to an N plan that might be cheaper, you can do that 365 days of the year. You have to, it depends on your state, might have to go through health underwriting, all that kind of stuff. If you have a G plan that's starting to cost you a little bit of money, you want to check to see if there's a cheaper G plan out there. Again, you can call Chapter there, 100% free, and they can see whether there's a cheaper G plan or whether you can go to an N plan or whatever the case may be, and tell you whether you have to go through health underwriting or if they can find some exception to the exception. So they prorated the difference between the widow's benefits that I was actually receiving, what I start receiving on SSDI. That's what they give me. Yes, it's not really prorated. One offsets the other. Yes. So you're receiving SSDI, Social Security Disability Insurance, and on top of that, you're receiving surviving spouse benefits. And yes, one offsets the other. So, all right, we are getting close to the end. IRMA, income-related monthly adjustment amount, added on to your Medicare if you earn too much, if you get a large amount of money. Yes, that is a fact. I'm going to do a video on that probably within the next week or so. It's time for me to do another video on IRMA, particularly with people selling homes and stuff and how that affects. Congress never made an exception. I wish they would have made an exception for, capital gains from selling your home, but they didn't. So my sister had a 1973 Maverick, brand new green, paid $1,800 for it. Yeah. Is that the one with the big six? Yeah, spent a lot of times with going to the beach in Florida in that car. So I guess so I would like to be a resource. I sent you a LinkedIn message. Oh, okay. Perfect. Let's see what else. I don't think from IRA is not earned income. So why would it affect your IRMA? Yeah, IRMA is completely different. Yes. IRMA is completely different. It counts the sale of a house, capital gains, stuff like that. So if you take a lot of money out of an IRA or, whatever stocks or bonds or something like that, it just might affect your pot or your MAGI, modified. That's the modified adjusted gross income. It won't affect your Social Security benefits unless you receive an SSI, but it just might put you in a higher bracket for 1 year for your Medicare Part B or Part D. Yeah. Is Obamacare going to end? I'm disabled drawing. I certainly hope not. The Affordable Care Act, marketplace insurance, whatever you want to call it, they've tried for a long time to end it, but it's still there. But unfortunately, the prices for a lot of people are going to go up. The premiums for a lot of people are going to go up a lot, a lot. So there are going to be people that are going to be kicked off of Marketplace, Obamacare, Affordable Care Act. And, you know, that's with every insurance. If you got fewer people in the pool, then prices go up because, you know, insurance is a risk pool. You know, why we pay, you know, car insurance is, you know, hopefully we don't have an accident, but we're paying for people that had an accident yesterday. So you got fewer people in there and then the prices go up for everybody. Yeah. So it's unfortunate. All right. We are over an hour and, Sammy and company, we need healthcare, healthcare for all. Like so many other countries, our government going after people trying to find anything to throw you off. This really has to stop. Yes, we agree. And our community here is putting together a program to help people that are eligible for benefits make sure they get those benefits. Too many people just aren't just able to do it. Too many barriers. The bureaucracy puts just up too many barriers for the people and they need help. So we're going to help them. So we're dependent on our community there, the best community on social media. So, all right, y'all take care. That's it for today. I'll be back tomorrow, answer more questions, come up with some type of topic for tomorrow. And until then, please, 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 please take care of each other. Bye-bye.